Hello, so I want to go over the ATA reassessment with a little bit more depth than I did in the last video. So this is part of the assessment station in the OSCE, and we're just going to look at what the examiners really want you to say, and they need you to say every part of this to get a pass. Really need to learn it off by heart. So this is what this video has been created for, to try to help you as a learning tool. So basically we're going to think about the airway, and firstly, is the patient talking to us in full sentences? Have they got an open airway that's not obstructed or partially obstructed? Do they have a face mask on? You might mention that here. And breathing, so what we're looking for in breathing, just think about when you are looking at a patient, what are you looking at? You're going to check their pulse and the respiratory rate together within 2 minutes. So you're going to do the pulse first and then the respiratory rate. And basically when you're looking at the patient, is it a normal rate? Is the depth normal? Is there a rhythm to that? And like I mentioned, you're going to do that for a full minute. And are they using much effort to breathe? So that would be an indication if the patient is in respiratory distress. So that's what we're really looking for. Somebody who's using nasal flaring to breathe or pursed lips, again, is struggling. Are they using accessory muscles such as shoulders, intercostal recession, which obviously an actor wouldn't be able to demonstrate in the OSCE, but these are what you're looking for in normal. Peripheral cyanosis, so is somebody cyanosed? Are they blue? So let's have a quick look at cyanosis in a picture. There's a picture of somebody with blue lips, and that is cyanosis. So they could potentially give you a patient with blue lips, where you'd mention it. But also sweating. So is a patient clammy? It's a sign that they're struggling, they're not getting enough oxygen around their body. Cyanosis, as we said, is a bit more difficult with darker skin, but please look at their fingernails as well. So what are their saturations doing? So in a patient that has a saturation of less than 96%, we'd know that is an abnormal stats. And when you're checking their fingernails, make sure that they're clean from nail varnish, dirt, blood, any of those things. Just verbalise that to the examiner. And please avoid putting the SATS probe on the same arm as where you take their blood pressure. They don't like you to do this in the OSCE. They say it changes the saturation levels, so you must use a different arm. What are we listening for? So we're listening for noises such as crackles, wheezes, cough and stridor, and you must listen out and just mention all of those things. And is it normal? What would we be feeling? So equal air entry. If a patient has unequal air entry, it could be sign of a pleural effusion or a pneumothorax. So we want to see the chest rising normally, but also the seesaw breathing. So if their stomach's coming up at a different sort of time, this is a seesaw breathing, which is unusual. All of these things are possibly respiratory distress, and they're really essential things for you to call a doctor now to come and examine them and see why the patient is in this distress. And the cap refill time. So that was part of thinking about the circulation. So when we check for the cap refill, we usually do it before we do the SATs, but you just need to press the fingernail for 5 seconds, and the blood should be returning within 2 for an adult. And any longer than that may indicate poor circulation of vasoconstriction. Palate and perfusion, is the patient a normal colour? So if they are darker skin as well, you may need to look at the lower eyelid like this, and is that a normal pinky colour, the mucous membrane there, or is it now pale like that one? So that might be a problem. Perfusion, is the skin got a reduced blood flow to it? Is they experiencing tingling, numbness, coolness, or is it mottled, that sort of pattern that you see sometimes on people's skin? That could be a sign, any of that they have an external or internal bleeding, so that would be a worry. What's their blood pressure doing? Is it a normal range? Please learn the ranges that they have on the news chart. 111 systolic and above is normal. Up to 220, but obviously you take that into consideration, a higher blood pressure, what's normal for the patient. And also think about the diastolic. So please do monitor the diastolic, even though we don't score it, we should know what's normal. So when you're checking their pulse, I mentioned that you're checking the respiratory rate for a minute and the pulse for a minute, and we tell the patient that we're checking their pulse for 2 minutes, we actually check the respiratory rate for a minute at that time. So just lightly press their artery, the radial artery there, and you're checking, is it a normal rate, rhythm and depth, or is it got any abnormalities, so an irregular heartbeat, or is it quite a weak thready pulse? So we need to mention all of those things. Disability, they're asking about the patient's alertness. So is there any problems with them in terms of, are they becoming confused? So if you get a patient that has a confusion in the OSCE, you need to ask whether the patient had that pre-existing condition. The Alzheimer's patient obviously has a level of forgetfulness and confusion, but is it now worsened? And if it has, you need to score them for it. So is the patient responsive, or are they losing consciousness is the other part of this disability as well. So for the AVPU, well, we called it AVPU before, but they put this confusion in now. So do you have to administer pain to a patient to get a response? Do you squeeze the trapezium muscle, or are they unresponsive to voice or anything? Any of those things all score and all cause for concern, and we need to tell the doctor. So if a patient was deteriorating, we would start the Glasgow Coma scale checks on them, but I'm going to go into that in another video. But then you do need to do the A to E assessment with that patient with the head injury and the OSCE as well, so we're going to do that separately. What about their urine output? Have they passed urine today? Several times a day is normal. Over 6 hours is abnormal, so we need to ask the patient if they've passed urine recently. The blood sugar level should be between 4 and 7 millimoles, and if it's not within those levels, let's just say that we're concerned about that as well. Exposure, so this is the patient's temperature, and we're going to use those infrared thermometers to scan across their forehead and see that the temperature is between 36.1 and 38 degrees. Lower temperatures being a higher significance if a patient is septic. So we're meant to be detecting early deterioration in patients using this scale, using this system. And they also checking their skin. Is there any signs of rashes, wounds, infection, bruises, swelling? These are all things you would consider when a patient came into hospital or you went to assess them. And a history of their medical history. So knowing a patient's medical history can obviously determine how we look after them and some of the considerations. So we need to know their background and look at that on the chart that came with the patient, and just ask the patient, is that normal? So these are all the things that they want in the A to E assessment. There are other considerations in holistic assessment, which I'll go into in another video, but I hope this has been helpful for you.